Hello, my name is Daniela Casale, and I work in the School of Economics and Finance at Wits University. One of my main areas of research over the last 20 years or so has been the field of gender economics. So when COVID-19 hit South Africa, one of the key questions I was interested in was, how would women be affected by this crisis relative to men? Quite early on in the lockdown, I was asked to join another 30 or so academics from around the country to be a part of a very large data collection and research project called the NIDS-CRAM survey. And in this webinar, I'm going to present the findings from wave one of the NIDS-CRAM survey on the gendered effects of the crisis in South Africa. This work was conducted along with my colleague and fellow gender economist at Wits, Dory Posel. If you're interested in more detail, please visit the CRAM survey website for a longer policy paper, as well as a short policy brief on the topic. And the data are also freely available for download. So pre-COVID-19, women in South Africa were already in a more precarious socio-economic position relative to men. They were less likely than men to participate in the labor market, and when they did, they were also less likely to find good employment. They're also far more likely to be the primary caregivers to children, reflecting the typical gendered division of labor. COVID-19 hits and we have lockdowns and school closures implemented, and of course this presents massive shocks to both the labor market and to care work happening in the home. And so we were asking in this research, what are the effects of the hard lockdown period on women's and men's employment and on their time spent on childcare? In a nutshell, what we find is that both women and men were severely affected by this crisis, as you might expect, but the effects have been much larger for women. What this means is that gender gaps have increased in South Africa as a result of the crisis and the early lockdown period. Let me tell you a little bit about the data before I present our key findings. The NIDS-CRAM is the largest non-medical research project on COVID-19 currently underway in South Africa. And its main aim is to collect key socio-economic information related to the crisis. So, for example, information on employment, household well-being, and also some health behavior. Interviews were conducted by telephone in May and June, and questions were asked predominantly on two periods. The pre-COVID period, or February, so that we would have some kind of a baseline measure, and then the hard lockdown period of April. Approximately 7,000 individuals were interviewed in total. These individuals were drawn from the sample of NIDS participants from 2017. What this allowed us to do was to access a broadly representative sample of South African adults aged 18 years and older. The first wave of NIDS-CRAM was released on the 15th of July 2020, and we hope that there will be at least another 4 waves of the data forthcoming over the course of the year. I'll present 2 slides from the employment section of the paper, and then 2 slides around the care economy. So our first key finding on employment was that job losses were much higher for women than for men. So in February, women accounted for just under half of all employment, so that was pre-crisis. But they accounted for a staggering 2/3 of the net job losses that occurred between February and April. That amounts to almost 2 million of the 3 million net jobs lost over the period. I'll share with you the US statistics to help put this into perspective. So pre-COVID, women in the US also accounted for just under half of all employment. But in April, they accounted for 55% of the jobs lost. Already based on that figure, commentators in the media, such as the New York Times, were referring to this recession as a she-cession. And of course, in South Africa, we are seeing a way more pronounced effect for women. The second key finding is that the most vulnerable suffered more. So this bar chart shows you the percentage of the employed in February who were without a job or even a job to return to in April. And it shows you this for women and men overall, by race, by their position in the earnings distribution in February, and by educational status. And what you can see is that Black African women were affected more, as were those in the bottom third of the income distribution, as well as those without a post-matric or tertiary education. A particularly alarming figure is that almost half of all employed women in the lowest third of the February earnings distribution were without a job in April. So those women who could least afford another knock were affected more. At the same time that there was this massive destabilization of the labor market, there was also a large shock happening in the home. When schools closed on the 18th of March, there would have been about 15 to 16 million children at home who would otherwise have been in some formal educational institution like school or an early childhood development center or some other childcare facility. That's a large additional childcare load in the home. And of course, because women were the primary caregivers to children pre-COVID-19, it's not surprising that they also have borne the brunt of this additional childcare work. And this is for two reasons. The first is that women are more likely to be living with children in South Africa than men are. So 74% of our sample of women reported living with at least one child at the time of the interview, compared to 61% of men. But even if we account for household composition, and by this I mean we restrict our sample to men and women living with children, we find that women were spending more time on childcare than men in April. So this bar chart shows you, for those living with children, the extra time spent per day on childcare in April. I suppose not surprisingly, given how much childcare work increased in that month, most people living with children said they'd spent extra time on childcare. Only 27% of women and 34% of men said they'd spend no extra time in April on additional childcare. What did surprise us was how much extra time people were spending on childcare when they did. So 58% of women and 43% of men reported spending over 4 extra hours a day on childcare, and that's in addition to what they were doing pre-COVID. Of course, this will affect people's ability to do paid work or uninterrupted paid work, and it probably has other knock-on effects on their physical and mental well-being. What are the implications of these findings? Well, these gender differences and the effects of the crisis further entrench socio-economic gaps that already existed between men and women in South Africa. And because women are more likely to live with children than men are, this increased vulnerability among women will translate into increased vulnerability among their children. In NIDS-CRAM, we found that almost half of women said their household had run out of money to buy food in April, and 17% reported a child had gone hungry in the previous 7 days. Looking ahead, we will want to monitor how these effects change as the economy reopens. Will they be reinforced or will they be ameliorated? And we hope to do this with the following 4 waves of the NIDS-CRAM survey. Before I end off though, I'd like to raise one possible silver lining from this crisis. And that's that even though women have been doing more of the additional childcare load, men have also been doing more childcare during the lockdown period. Whether this has longer-term transformative effects remains to be seen. But at the very least, even if the distribution of care between men and women reverts to pre-crisis levels, what this crisis has certainly exposed is the importance of childcare work typically done by women and girls, and how important this work is to sustain work in the paid economy. And it's also exposed the difficulties of combining childcare work with working in the paid economy, whether that's in a job outside the home or trying to work from home. And so we can only hope that in the future, organizations and firms might rethink the way they organize their workplaces and workforces to also take into account men and women who need to look after children. Thank you for listening to this webinar, and we'd hope you'd visit the CRAM survey website for further details on this work and on the other research papers in the collection.